When I get older, losing my hair, many years from now, will you still be sending me a Valentine?
Good afternoon and welcome to Berkshire Senior TV. My name is John Lutz. I'm the Executive Director of Elder Services in Berkshire County. And today we're going to talk about a program that, like Elder Services, covers the entire county of Berkshire County and all 32 towns, and that's community health programs. And we're thrilled to have their Executive Director and Chief Executive Officer here, and I'll let Leah introduce herself.
Thank you, John. It's my pleasure to be here this afternoon, I guess it is.
Yeah.
This wonderful snowy afternoon. So Community Health Programs was founded in the early 70s, and it actually was called Children's Health Programs for a number of years until it expanded, I'm going to say probably somewhere in the late 90s, early 2000s, and became a community health center. Mm-hmm. And as a federally qualified community health center, which we are, we take a small amount of money, very small amount of money from the federal government, which ensures that people who need to receive health care, who can't afford health care, will actually receive health care at one of our centers. So it's an important component to being sure that patients and individuals in the community and their family have access to services that they wouldn't ordinarily have because they're uninsured. We are between Great Barrington, our southernmost facility, up to North Adams. We have about 9 locations, but they're not all primary care locations. Mm-hmm. We have 5 primary care locations spread out between Great Barrington and North Adams. We have 2 dental centers, one in Great Barrington and one in Pittsfield. And we also have an obstetrics and gynecology practice, which is in Great Barrington. And we have family services, which is located on the Great Barrington campus, which houses the community health center and also the administrative headquarters for it. So all in all, that's 9 different locations. When I came to the Berkshires about 2 years ago to take over community health programs, I went through a process of probably bringing on board 4 new health centers for us. So it took us from a population of about 2015. 2015, the population was about 19,000 patients, and today we serve close to 35,000.
And where did those patients come from? I mean, that's a lot of growth in a pretty short period of time. So were they going without before?
Some were going without, but the majority of them were in existing primary care practices. Mm-hmm. That the difference between, the federally qualified health centers have a lot of added features that make it easier for them to survive financially in very difficult times because of the federal contribution, because of the fact that we do not pay for malpractice insurance. We're covered under the Federal Torts Claims Act. And private practices basically came to us, and this has been sort of a history of CHP expansion, have come to us and said, we really are having a hard time making ends meet. Would you be interested in bringing us under your federally qualified health center umbrella? And of course, we always say yes, because we know that we can continue, the continuity of care will be there for those individuals. So the increase in population came from taking over 4 private practices in, pediatrics. I meant to add pediatrics. We have pediatrics in Pittsfield proper. And also, we acquired 2 primary care practices, one in Adams and one in North Adams, along with the dental residency program that BHS had. So we have, within our framework, we have 2 residency programs, which is really important to the Berkshires, because these are opportunities to train people in the Berkshires to do their respective professions, whether it's dentistry or whether it's primary care medicine, and then hopefully stay on.
Right.
And we've had good fortune. We've actually hired in my time, 2 years, 3 residents from each of the residency programs, medical and dental. So it's been
Which some people might not think, well, geez, but in Berkshire County, that's a lot. I mean,
It's a
that's
lot.
a real change in the medical profile of Berkshire County.
I think the other thing important to note too is just how those 35 patients, kind of who are those patients? And I like to say close to a third, and a third, but that's leaving little for the balance of the population I'm going to tell you about. But a third of it Medicare, a third of it private pay, individuals like you and myself. I happen to be a patient of community health programs. I thought it was important so that I could know how well we were doing. And then a third are the Medicaid population. But really, you squeeze it a little bit, and there's probably not quite 10% of individuals who are on a health safety net, so they don't have any insurance. And it is a mandate of federally qualified health centers that you have to treat anybody who comes through the door, regardless of their insurance status. And I think that's key, because there are a lot of people that you don't actually see until they show up who don't have health insurance, and maybe they live in the hills or they live places where you're not necessarily going to see them, which reminds me, and I always forget to say this, but we have a 10th site, which is our mobile health unit. And some people may have seen it in the community, and we go to schools, we go to events, we do ophthalmological work on there, we do dental varnishings on there, we see patients on there, and people come to love and to look forward to seeing our van and the individuals on it. We also bring our outreach and enrollment people on there, so they're on the van. So if you need or have difficulty with Medicaid or Medicare or whatever insurance you have, our specialists will actually help you to do it. So it's quite an important feature, and our hope is that we're going to expand our ability to take that van out into different settings further up in the north. It's largely been in South Berkshire County, but we really do believe that we can take it up to central and northern Berkshire County on a much more frequent basis.
Right.
And it's our hope in the coming year that we will have that mobile van out 3 days a week, every week, going in whatever direction it needs to go to.
And not unlike when we have an opportunity to be part of a health fair or an event at a COA or something like that, where we're trying, and I'm sure part of it is you're just trying to make that initial connection. And if you can make that initial connection, then a lot of times, then you have someone under your umbrella for years,
Right.
which is good for them, and good for you.
Right. And the interesting thing about the mobile health unit is that sometimes people will only go to the mobile unit. They don't want to
come to the office.
They don't want to come to the bricks and mortar. And so I think if we can get it out into the community more, if we're not out there, those folks will likely go to the emergency department. But if the mobile van is there, then they'll go to the mobile van.
Yeah, it's that link in between which gives them an alternative to going to the emergency.
Well, and it's doing what we are all trying to do, which is taking health care to the individual wherever he or she or the families are, because there's one of the things that I've been quite actively involved in Berkshire, in the sum total of the Berkshire counties, is transportation, because we know how hard it is. And I know from a healthcare perspective how difficult it is, because you got to get to your appointment, and then you may have some follow-up appointments, and then you need to go to the pharmacy, make a stop at the grocery store on the way home, any other things, go to community, kind of social communities where you can go and be with people and have those. And it's very hard if you don't have a transportation system that really can support that. So I've been part of a Berkshire County working group that has also included Senator Adam Hines and several other individuals from his office, as well as the Berkshire Regional Transit Authority, CHP as a member of the healthcare community, and MCLA and their design lab to help us think through how we might architect a slightly different design using some innovative technologies, maybe utilizing technologies that can track and trend where people are and where they're going, they get to a node, but they get dropped off at one node, and then how do they get home?
Right.
Well, creative ways to do that first and last mile, maybe utilizing private resources to be able to do that. So it has to be important, and I think in particular, I think it affects all the population, but I also think it may have a more significant impact on the elderly population because they look forward to the social community that they want to be a part of, and they have more advanced healthcare needs than the younger population. And so for them to be dependent on a taxi cab, of which there are not many, or some other kind of a ride, means that pretty much an entire day could be lost for them. So I think this is something that will be tremendously important to the entire community, but in particular to the elder folks.
And I think that's a great segue. I know both of us work in the world where the phrase social determinants of health comes into play, probably from different perspectives a little bit, but maybe talk about, and transportation being one of them, talk about how that plays into when you see someone in a healthcare facility. What does that mean, the social determinants of health, and what are you looking at or trying to determine in that case?
So that's where, importantly, our family services kind of service comes in to play, and it's largest in the South County area. We're hoping that we can expand into North County. It includes WIC and the family services, but more importantly, when you think of an elder population, you think of fuel, and you think of food sustainability, and you think of just how they live and how their apartment. Many studies have been done to show that if you put an air conditioner, the cost of an air conditioner against what the cost would be to you. So really doing a 360 assessment of what are the needs of that individual, and then marrying them with the resources. So I would say that family services for us is a clearinghouse of many different other agencies that have an impact on your health and well-being. So it isn't just going to the dentist or going to the doctor or seeing the eye doctor or whatever. It's all those other things that help you run your household.
Right.
And that's what's really important. If you don't have them, you won't run your household.
And that's what, I know when we go in and do an assessment, and see someone for the first time or go back for a reassessment, we're doing that same thing. And we always, when we partner with healthcare agencies, we are in someone's home. We are there. We're taking that 360-degree view. We see them. We might see them every day if, say, they receive meals. And we're delivering in our drivers. So, we are always trying to look for opportunities to share that, because we know there's kind of a healthcare part and a medicine part, but there's also, well, what is the environment which that person is actually living day to day? Right,
because the medical help won't do very much good if you're not getting at some of the organic things in the household. Right.
Well, and even the we always promote the councils on aging, the meal sites, activities, getting out, again, that social determinants. And I know there's all kinds of percentages of how much that plays in your healthcare, but it's part of getting out and having a fuller, healthier life.
Well, and I think what you're doing and what we try to do, probably not nearly to the extent that you do, is that we become kind of a systems integrator. And there are so many resources around Berkshire County that if we know who they are and what they do, then agencies like yours or mine can pull those in on an as-needed basis without trying to reinvent the wheel, because we certainly don't want to do that. But so our family services really picks and packs the necessary services and agencies together to then provide that to the individual. And we also recognize that there's been a high need for, financial literacy and being able to teach that to the, individuals in the community. We offer now, fortunately, we were able to get a grant through Greylock to do remote video interpretation of services, so that doesn't matter where you are in terms of one of our facilities, you're going to have access to someone who speaks your language and understands and can communicate with you, because you think about how much information you're trying to communicate in the course of a particular visit, and it's unimaginable that individuals who have a language problem could really hope to retain any of that information.
And I don't know about you and your programs, but we're starting to see more of that need as well. And we started to see it particularly this year in our SHINE program, where we're doing Medicare counseling and that type of thing. Are starting to see the changing demographics of Berkshire County showing up and kind of in places that are offering assistance or trying to help people get connected. And we're starting to see it more just in the last year or so.
And I'm certain, and we talked about this earlier, that a lot of people have heard about, been confused about the accountable care organizations that have come into play, and in particular the one that's the Berkshire Fallon Health Collaborative, which is one that we at Community Health Programs and Berkshire Health System and Fallon from a clinical standpoint are partnered up. But what that means is that we have to have collaborative relationships with outside agencies like yourself for mental health. The long-term social services supports are really important, and the mental health are really important. And so to create this big network that people need to know about so that they can be referred to the services that are most important in their entire treatment plan. So it's taking a total view of the individual and saying, what are all of the things that you need, and connecting all of us together, not just through agreements, but through technology, so that we can share information, so that individuals and the agencies that need to serve them are connected up, and that at the end of the day, the primary care physicians know what's going on. And I think that's been really important, I think, for this community, is to have that kind of linking together of all these services.
Well, and I think it very much plays to the idea of population health. You've got a population of folks with a particular profile, whatever it might be. How can we help keep not just an individual healthy, but how can we work with the whole group, and by connecting systems? And I know we are far down the list. You're in the top rung there. We're down the list a little bit, but there's a particular population that we work with, that we can work with healthcare providers to help keep those folks healthier. And I think that's the overall, whether be elders or kids or or families or whatever it might be.
Right. It's for any population. The other thing that I wanted to mention, that when Fallon came into this community and asked us to be part of this accountable care organization, they also are providing a product through Fallon called Navicare, which I'm sure you've heard of.
Right.
And it's a dual eligible, which means you're Medicaid and Medicare. So you need the assistance of Medicaid. But there's some, I think, 2,000 individuals within our community who are eligible for it. And getting back to social determinants of health, it's everything from rides to the senior center, to eyeglasses, to grocery coupons, all those kinds of things that are important on a monthly basis to be able to make it from one end to the next. And I think that's a good, they've been marketing it. I think there's going to be more to come.
Yeah, and the partnership we have on that is that we employ the geriatric support services coordinator to provide an objective voice in the determination of the care plan. So we share. We're working with them, but we have someone. They have a team, and we work together to make sure that people are getting what they need, not more than what they need, not less than what they need. And it's certainly it just started January 1st, but they're already. I think we recently passed the 100 threshold, which was kind of a milestone for a number of enrollees. But they certainly have very ambitious goals about, and I think. From our standpoint, I know when it was first coming on, people, and maybe this was the same with as you introduced and started to work with some of the private practices, this wasn't something where they're cannibalizing us or we're trying to prevent them. This is bringing another type of service to Berkshire County and letting people figure out what service do you need, and saying, well, that's the one that we're going to provide to you. So it's not a zero sum. It's not well, if they're here, then we're doing less. They're working with one population. We're working with a different. Sometimes we overlap. Sometimes we work together. But it's not a competitive environment.
Yeah, and I don't think what I've seen here in Berkshire County is, over the last couple of years, is more and more examples of this kind of collaboration. There's a grant that we're fortunate enough to be one of the core participants in, that is affects southern Berkshire County, but my thinking is that at some point you could do a similar thing in North County or in Central County. And as part of this rural health network,
right.
it is saying, what are all the agencies that we have, and how do we figure out how they can fit together to bring support to the individuals in need, whoever they are. And I think that's so important because there are lots of small groups doing their thing and some doing over here. And I don't think that, then I think people slip through the cracks. I think we miss people who could benefit from it if we were all.
Right.
And the key really is information technology is, how, and that's something that I think will grow in time, but I think it's very important because if you don't know, you've treated somebody or they've taken some services that they've needed and you have no idea what they were or when they had them, it makes it very difficult to follow up with that individual. So I'm a big proponent of the use of technology, whether it is in, handhelds or phone or, large databases that can take information and pull it together and serve it back out to other people. I think the more time we can spend figuring out the communication channels, I think the better off the folks that we're looking to take care of will be. And the greater their access to care will be because we'll know pretty quickly what they need and what will work for them.
There was a nice article about the listening sessions they're having for that grant in the Eagle today, and I think those even the comments that were in the paper point out we have some particular challenges in Berkshire County. It's a little different than being in downtown Boston or Worcester or wherever or Springfield because of we talk about technology. Well, does every person have access to the internet? I think it's not that it can't be done, but you have to think about it as what are the particular challenges locally that we're going to have to think about.
Yes, you're absolutely correct. I think that there's certain areas that don't have access to broadband. So how are you going to utilize technology like that? You can send people out to those areas that have the ability to capture and then download once they're connected to a network. But there are more than not. Having run health centers in urban settings, I know absolutely that it's a lot easier.
And I know we're just in the last few months we've started to convert over where we have now much more manageable laptops and tablets where we're going out and saving, not having to put it on paper and then bring it back and trying to, and so we're trying to do more of that with our caseworkers and nurses to make it a little bit more efficient, but also to have access to that technology. And most places they have it, but sometimes they're like, wait, I don't not, so you have to go back to paper and pencil.
Well, and also the thing that I love to say, because my mom just turned 87.
Bless your heart.
And she's not in great health, but she's okay. But she is a technology maven, and anybody who says that seniors don't embrace technology, they are so wrong.
Yes. Here they'd like to embrace it, they just can't.
Can't get access to it.
Can't get access to it.
Exactly.
So when thinking about your programs, obviously you have a great partnership with Berkshire Health Systems, and I know one of the things that we've experienced, and sometimes in comparison to like the Pioneer Valley or in the East, is we're kind of out here and we all know we're kind of it. And so we don't have that competitive, it's like, well, this is my lane. I'm not really interested in your lane. We're just, and how does that work kind of in the healthcare world?
Well, I think that one of the things that's critical here is that if we work together, the boats float higher. I absolutely agree with that. And I think that we have, by the very unique nature of being a federally qualified health center, we have a different approach and we have different skill set that we bring than do, let's say, physicians in private practice. They're a whole different animal. And I think with Berkshire Health System, they are the hospital, they are the health system. We have a wonderful relationship with Fairview Hospital down in South County because that's where the women who come to us who are pregnant or need other types of gynecological procedures actually come to our facility down there, and then they go and they have their surgical work done or they birth their babies at Fairview Hospital. So I think everybody's figured out, this is my strong suit, this is your strong suit, this is your strong suit, and I don't want, gentle person's agreement that I'm not going to try to get in your space about this, because that's going to detract from what it is that I know I can do. And also, I will say, very frankly, that the level of openness and communication amongst certainly the core healthcare people and the broader set is extraordinary. It really is extraordinary, and I think that's just, maybe it's in the drinking water out here. It's something, because it has not been my experience in the other institutions that I've run. So
yeah, and I think in the human service world, it's much the same. And I think for us, when we were doing the ACO and joining an alliance and trying to get prepared for that to be one of the folks that might get referrals, we just called each other and sat around a table and said, okay, you're going to do this, I'm going to do that, and that was it. Talking to my colleagues in the East, not quite the same collegial environment. Well, everybody was worried about what their piece was. Well, I got my piece. This is what we're doing. This is what we do when it's your turn. So I think there is that difference of just there's just one of each of us. There's not a lot of competition.
Well, and that's true, because for us as federally qualified health centers, there are 1, 2, 3, 4, but really we're the only one here.
Right, yeah.
And then the balance of the 35 of them are all in the eastern part of the state. And so they are. I mean, some of them are like within a block of one another.
Right, which,
I mean, it's crazy. It's totally crazy.
So it's, it's just a different environment. But we're about out of time, so I just want to thank you for coming, and I hope you'll have a chance to come again. It's our pleasure, and always glad to partner with you. Yeah. And I want to thank everyone for watching Berkshire Senior TV, and we'll see you next month.
Would you lock the door? Will you still need me? Will you still feed me when I'm 64?